Welcome back to the 4th annual Rush Lupus Clinic and LSI patient education event. We are about to get started with our 3rd presentation. This event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status.
Thank you so much for sticking around. I think we get a lot of questions about eating and what patients can do in relationship to their lupus. So I'm very excited to introduce Dr. Arora. People refer to her recently as mini Dr. Jolly. She did her residency at Stoger Hospital and currently is a senior fellow in rheumatology with special interest in lupus. She has a lot of research work, recently published also on pneumonia vaccination and quality of care in lupus. So this is a person you will see a lot in the lupus community over in the near future. Welcome.
Thank you, Dr. Jolly. I just want to make sure I'm audible to everyone and my screen is visible to everyone.
Yes.
Okay, great. Thank you so much for a lovely morning. I want to deeply thank Dr. Jolly, Dr. Sequera, Dr. Nika for giving me this opportunity to learn myself more on healthy eating and how important it is for our lupus patients. We've had such lovely talks about COVID-19, osteoporosis, and all of these issues being really big issues. Definitely COVID-19, with half of all of us talking about it half of the time. It's exciting now that we have the vaccines and we can look forward to this. The osteoporosis talk was exceptional. Thank you, Dr. Khandelwal. I'm going to piggyback on that and take some nuggets from it and talk more about calcium and vitamin D when I'm talking about this. So let's get going. My agenda for this talk would be to talk in general first about what is healthy eating, and then we will dive into what different types of diets there may be, not in detail though, and then again about some supplements. This is something, as Dr. Jolly mentioned, our patients do ask us a lot about. Lupus is a chronic medical condition. Once you have it, more often than not, you have it for the rest of your lives. So we as our patients and we as providers do want to do everything we can to make a difference in your lives, and then healthy eating and lifestyle changes are an essential part of I think care in all chronic conditions, not just lupus. More often than not, you're taking lots of medications and they have their side effects. The disease has its co-morbidities and such. So I think it's an important topic for lupus. So we will try to delve into how these healthy eating habits, these supplements or these diets have been studied in lupus. I'll briefly talk about some studies. I would say there are not a lot of great studies looking at these dietary habits and supplements, but there are some, and we'll try to find out about them. And then lastly, I would like to give out some resources for you to go back and look at and try to implement some of these things in your life. So coming up with what is healthy eating. This is something which I learned myself, and I've been educating myself for the last few weeks, reading the dietary guidelines for Americans. This is something which is updated every 5 years, and this was published in 2019. This is the 8th edition, and they define healthy eating as something which is includes a variety of food items. So consume a healthy eating pattern that accounts for all foods and beverages with an appropriate calorie level. That's the definition. They want us to eat variety of vegetables from all of these subgroups, and we'll get to that. Fruits, especially whole fruits, grains, and we'll delve into details of all this, but at least half of the grains should be whole grains. Dairy, preferably fat-free or low-fat. and we'll talk more. And then a variety of protein foods, from seafood, lean meats, poultry, eggs and legumes and things like that. And then finally oil. So these 6 category of foods. In my mind, I try to divide them because at the end of the day, to be more thoughtful of what you eat, I guess it's nice to divide these and then make sure you're including them in some way or the other in your daily routine. Let's talk about each one of them a little bit. When we talk about vegetables, they are divided into these 5 groups. They are dark green vegetables, depending on their color, red, orange, they're legumes, which can be classified in vegetables, but also in proteins. They're starchy vegetables, and then there are others which cannot be classified into any of these categories. From the dietary guidelines, they include all vegetable options, not just fresh vegetables, but also frozen, canned, and dried options in raw or cooked forms. And they also include vegetable juices. So I understand if I were to recommend everyone to eat fresh vegetables and healthy food and things like that every day, that could be costly. So you've got, or we have got a lot of options. We have got options of frozen vegetables and canned vegetables. Make sure to include all kinds in different proportions in your diet. The recommended amount of vegetables in this healthy US style eating pattern is at the 2000 calorie level. So in general, just to specify, for an individual, it varies from age and gender, but 2000 calorie level is your standard amount of calorie you need in a day. So keeping things standard at 2000 calorie level, you should be eating at least 2.5 cup equivalents of vegetables every day. Now, looking at a number, I honestly, if I'm not conscious about it, I don't think I would end up eating 2.5 cups or even 2 cups or 1 cup of vegetables. So that's why I like the idea of dividing these into categories and then making sure that I can make these a part of my diet in everyday routine. The next category is fruits. So the fruits food group includes whole fruits and also 100% fruit juices. Important to note that these are 100% fruit juices. The commercially available fruit juices could be diluted, could be 30%, 50%. So it includes whole fruits, which could be fresh, canned, frozen, and dried forms. The recommended amount, again, at the standard calorie level is 2 cups, 2 cup equivalents per day. Once we get into a habit of making sure we are incorporating fruits in our diet, I think it's not hard to eat 2 cups of fruit every day. But again, if you're not conscious about it, it's easy not to eat fruits and just get on with the day. The next category is grains. Grains could be single foods like in rice and oatmeal, or grains could be an ingredient of other things like in breads, cereals, crackers, pasta. Grains are divided into 2 big categories: whole grains and refined grains. Whole grains have the grain in complete form, and they include oats and brown rice. Refined grains, on the other hand, do not have their outer covering, the fiber covering. So they may be lacking in vitamins, they may be lacking in the fiber content. And sometimes these refined grains, to enhance their shelf life and enhance their taste, they may be mixed with saturated fats, and they may have extra sodium. And by sodium, I think we'll talk a lot about sodium in this talk. So sodium is salt, okay? And one big point, we don't want you, and for several reasons, we don't want you to be eating a lot of sodium or salt in your diet. So these refined grains sometimes could have extra sugar, extra salt, and saturated fats. So examples for these are cookies and cakes and snacks, and these you want to limit. You want to limit these refined grains, which have these extra things, not good for your diet. Now, again, talking about the standard calorie level and how much of grains you should incorporate is around 6 ounce equivalents per day. And they say at least half of the requirement should come from whole grains. The next compartment, so we have covered three so far: vegetables, fruits, and grains. And the next compartment is dairy. We saw a good picture and heard lots of good things about dairy and the calcium content and vitamin D and things like that. It's included in your healthy eating pattern too. For the healthy eating pattern, they do suggest that you eat fat-free or low-fat dairy. And then it includes all these milks, yogurt, cheese, and fortified soy beverages. As we know, as Dr. Khandelwal mentioned, there's so many of them. The recommended amount of dairy in this healthy eating pattern is 3 cup equivalents per day. And if you're lactose intolerant, that's a different deal. And then there are dairy products which are lactose free as well, or they are fortified with a lactase enzyme. But I think if you're not lactose tolerant, it's easy to incorporate 3 cups equivalents of dairy in your diet. You could a cup of yogurt, a glass of milk, a bowl of cheese. These are just some of them. The next big category is protein. Protein is derived from animal sources and plant sources. It could be from the animal sources. Again, we have the meats, we have poultry, we have seafood, and from the plant sources, we have the nuts and seeds and soy products. Legumes, as I said, can be categorized into vegetables or into these proteins group. The recommendation is at the standard calorie level that you should eat at least 5.5 ounces of equivalent of protein food every day. Lastly, the last category is oils. I think so. Oils, I would not go into details of fats but in general, what we should know, and as providers we try to explain to our patients all the time. So there are good fats and there are bad fats, and then when we measure it in your blood, there is good cholesterol and there is bad cholesterol. The bad cholesterol is the one which increases the risk of clots and increases the risk of heart diseases, which we often refer to as cardiovascular diseases. Oils are one of the good fats. They are liquid at room temperature. The fat content of these oils is more monounsaturated and polyunsaturated fats, which are good for your body. The solid fats, which is more butter, which is more in the meat, is more saturated fat, which ends up causing more bad cholesterol in your blood and increasing your risk of heart disease. So in the healthy eating pattern, they recommend you to have oils or to incorporate cooking with oils in your diet. And the amount they say is about 5 teaspoons per day. So I'm sure we are using that much in our diet all the time. I think that number helps me to remember that I should not go more than that. Okay. So these are the things, these 6 categories, which the healthy eating pattern tells me to include in my diet. The vegetables, fruits, grains, proteins, I missed one of them, oils, and then what things they don't want us to do. So they don't want us to take lots of saturated fat or trans fat. These are the fats which elevate bad cholesterol in the blood. They want us to limit added sugars and sodium meaning salt. So the direct recommendations are that less than 10% of your calories should be from added sugars, less than 10% of calories should be from saturated fats. And then in general, and this is not only for patients who have high blood pressure, it is recommended that you consume less than 2,300 milligrams of salt per day. If alcohol is consumed, it should be consumed in moderation, up to 1 drink per day for women and up to 2 drinks per day for men. And only, let's be official here, for adults of legal drinking age. So just reinforcing the healthy eating pattern, and then we'll move forward specifically to lupus. So look at the plate. The plate is supposed to have lots of colors. It's supposed to have, as we said, these 6 categories. So make sure to include vegetables and fruits in your diet every day. Try to get whole grains and less of refined grains. Include dairy in your meals, and preferably fat-free to limit those sugars. Include protein, and you have several options as we discussed. Include oils, but not too much, 4 to 5 teaspoonfuls. These are the things which we want to avoid in our diet. We want to avoid all of these added sugars from these sodas, from these cakes and all that. Once in a while, everything is all right, but these should not be the routine. They should not be your daily breakfast. Saturated fats, they lead up to bad cholesterol, lots of sodium. All of these processed foods, pizzas and burgers, obviously they're yummy and once in a while is all right, but not something which you eat every day. So, okay, let's look a little bit more. So how can you make sure that you're including these 6 categories? And as we go through more and more slides, we'll talk about more things like vitamins and minerals. And at the end of the day, I'll close back the circle and tell you that these 6 items, making sure you're including these categories in your daily meal, you will make sure that you're getting all the vitamins and minerals, which may have a role in keeping your disease under control, in protecting you against problems. Okay, so going from a regular dish of pasta, which has no color, which has no vegetables, add some zucchini there, add vegetables there, the peppers, your carrots, and then just in general, look at what you're eating for snacks. So switch chips and dips to vegetables, and like maybe eat carrots for or celery with a dip, instead of eating fruit products with added sugars. Eat the whole fruits. Instead of using white bread, which is more refined grains, which is basically less fiber and less of minerals, you switch to whole grains. Prefer to go and get brown bread. Instead of snacking with added sugars, you could use unsalted snacks, unsalted cashews. Switch your solid fats to oils. Again, switch your beverages with added sugars, your sodas to no sugar added beverages, and that could be a Diet Coke too. These changes can be hard. If you have been in a pattern of eating these kind of diets on a regular basis, it's not easy to switch to a healthy eating pattern, and this does not happen in one single day. And I'll be honest with you, I'm not following all of these healthy eating recommendations all the time. But I think if you take one step at a time and you decide to switch one habit, one less healthy habit, to one more healthy habit, that may be helpful. So take things slow, do one step at a time, and then slowly you will see that you would have made major changes to your diet, which in turn would be helpful for you at the end of the day. Okay, and then again from these guidelines, the other measures which we've been talking about through the morning, we should not smoke for several reasons. We want to protect our bones against osteoporosis. We just discussed about that. We know the hydroxychloroquine would not work as well for your lupus if you're smoking cigarettes. It is always a good idea to maintain a healthy weight, a body mass index of less than 25, and it is always a good idea to be active. This is the recommendation for everyone, not just people who have lupus, that one should walk, or one should be doing aerobic exercises for at least 150 minutes in a week. If you put it all together, 150 minutes in a week sounds a lot, but just spread it over 5 days, 30 minutes over 5 days, or 20 minutes over 7 days or such. And it's not that too much. You can give your body that time to exercise, and there's several benefits to it. So let's talk more about lupus, and let's talk about why this healthy diet is so important in patients with lupus, why it is especially important in patients with lupus. So as I was trying to mention, We know that there are heart diseases in general population, and the risks of those are more in people who are older, if they have if they have obesity, diabetes, if they have comorbidities such as high blood pressure. These all have been looked in patients of lupus in several studies. What I'm showing right now is actually a result from something called a meta-analysis. A meta-analysis is a is a research tool we have in which we combine all the data from different studies and try to look at it together. So in the top part of the screen, I want to show you that they are looking at the risk of cardiovascular diseases, especially in young people. Um, um, and this so the risk, let's say this is the risk line, which is at 1, and these are my lupus patients, which are on the other side of the 1, meaning they're at much higher risk of getting these heart diseases. And these patients may be as young as in the age group of 30s or 40s. So in different studies, these risk numbers have been reported variably, but at least 2 to 5 times, and in some studies as high as 10 times in comparison to general population. It is important to note that this risk is high even in very young people. You may think that someone is young and why would they have a heart disease? But because of several reasons, and they may be because of the disease. The disease causes inflammation in the body. That inflammation can trigger increase in bad cholesterol, that can trigger clots in hearts and cause strokes and things like that. And then the medications, the steroids, they are not helpful for your lipid profile. It also causes increase in cholesterol. It causes you to gain weight, and you all know that much better than me. Kidney problems, they give rise to high blood pressure, and that's a very big risk factor for heart diseases. This bottom part of the figure is all age groups, and then you can still see that these lines for lupus patients are much on the right side of 1, meaning they're at higher risk than general population. And then if we look again at just very young people who are less than 45 years of age, the risk is really high. In this one study, it was as high as 20 times. So that is something to pay attention to. That is something which we should not ignore. Um, we know our lupus patients have all of these comorbidities. 1/3 of lupus patients have high blood pressure. They can have cholesterol problems, diabetes, obesity, and then we just talked about and learned so much about osteoporosis. Often they also have anemia. More than half of SLE patients have been shown to have 3 or more of these risk factors, and more often than not, they have cholesterol issues, high blood pressure, and obesity. So I think these all reasons speak to the fact that it is important that these risk factors should be screened for in patients who have lupus, and they should be addressed. And one major role or one major intervention one could do for addressal of these risk factors is by changing your diet. Each one of these risk factors is prevented and lowered by eating a healthy diet. Okay, let's come to the next question, and we'll circle back to the healthy eating pattern in just a little bit. Oftentimes, when patients get diagnosed with lupus or just for a regular follow-up visit, I've been asked this: is there something else I can do? I'll take my medications, but is there something else I can do? Is there something I can eat which could help my lupus? Is there an anti-inflammatory diet? So when we go out looking, and I think some people may be more aware of this than me myself, and I am not a dietaholic or something. There are several types of diets out there. There are diets to lose weight, which are like low calorie diets. There are low fat, low cholesterol diets. There's the vegetarian or the semi-vegetarian diet. There's the Mediterranean diet, which has been which has been popular in the cardiology world and in our world as well for some reasons, and then others too, something like a DASH diet for patients who have high blood pressure. And we'll talk about DASH diet at the end of this talk because we did have a question about high blood pressure and diet. I'm not going to go into details of these individual diets. I do want you to know that each of these dietary patterns, they focus on eating healthy. And the principles of them are similar to what we have been talking about in the healthy eating pattern. One diet habit which has been talked more about in the scientific literature world is the Mediterranean diet. And the other diets are not much different than this one, okay? And if you read along the description of it, this is something which actually sounds similar to what we've been talking along all this while. So Mediterranean diet is a traditional dietary pattern which is based on whole or minimally processed foods, and we have been kind of emphasizing that. Limit those refined foods. High intake of vegetables, fruits, whole grains, fish, and olive oil, with moderate consumption of red meat and wine. So that's just a very brief description of Mediterranean diet and does not elaborately include everything. Mediterranean diet has been looked at in patients with lupus to see if it was anti-inflammatory, if it did anything to the disease activity. This was recently published in 2020, and what they did was they gave out questionnaires to lupus patients, and they included 280 patients in their study. These questionnaires asked them about adherence to a Mediterranean diet, and then they looked at these people, their risk factors for these heart diseases or cardiovascular diseases, their risk factors, and they also looked at their disease, the lupus. They looked at how active the lupus was and then how much damage they had gotten from the lupus. If I may just take a minute here to clarify one thing about lupus. Whenever we are talking about lupus in our scientific world, the physicians often tend to separate out these two things, activity from the lupus and damage from the lupus. And that's true for other rheumatic diseases also. Activity for lupus is the active inflammation in your body from the lupus. And then over time, because of the effects of the inflammation in the body, and then because of several other reasons and your medications and comorbidities, you could have damage in your body. For example, if you have inflammation in your joint and your joint is red and swollen, that's activity. But if your joint had inflammation years ago and now you have a deformity in your joint, that's damage from your lupus. The activity is the one which we treat with steroids and all of the medications you're on, and damage is the one we want to prevent, because once you have damage, that's irreversible. Okay, let's move forward. So what did they find? They found that those patients who had greater adherence to the Mediterranean diet had lesser risk factors for these cardiovascular diseases, and they had lower scores in their disease activity, and they had lower scores on these damage numbers. Now, what does that mean for me, and going forward, what should I tell my patients? I think for that, I looked at some of their tables and tried to see how are they making the conclusion, what were these patients eating. So if you look closely, several of these dietary items were different between patients who had active lupus and those who did not have active lupus. And again, this is looking at active inflammation from the lupus. So I think I would not endorse a strict Mediterranean diet for my patients, but I would rather go and see what are the components of the Mediterranean diet and then advise my patients to try those or to incorporate those healthy items in their own diets, according to their own preferences, just so that they can derive these potential benefits. So as you can see, using olive oil is something which is good for you. Again, the same thing, eating more than 2 servings per day of vegetables is good for you. More than 3 fruits per day is good for you. And you can see the numbers. Those who were eating more fruits, more vegetables, they were more likely to have control or inactive lupus. Now, and then just similarly, looking at other things, those who were eating more legumes, fish, less of commercial sweets or pastries. These are all good things. More servings of nuts. They are the ones who were more likely to have less activity from their lupus. And then what were the things which were not good? So eating red meat and hamburgers and refined products and no more butter and cream, and these all things were not really different, except that this meat products was lesser in patients who had active lupus. Now, I don't think that the healthy eating habits and the patterns, they replace your medications. Lupus is can be very severe, and it definitely needs to be treated with medications. But these healthy eating patterns could help your lupus and definitely help reduction of risk factors for heart diseases and vascular diseases, which we know have adverse consequences. Okay, the next question was, or the next question what my patients ask me all the time is, are there any anti-inflammatory supplements? What supplements could I take? Okay, and then amongst them, some of them I would go over. There's these omega-3 fatty acids, which include these two big fatty acids, the difficult names there, eicosapentaenoic pentanoic acid and docosahexaenoic acid, EPA and DHA, vitamins, minerals, and then there's some herbs like and I'm not going to get into details of all of these herbs. I'm no expert, but sometimes our patients do come across and have these questions for us, so we'll try to see what we have in the literature. Omega-3 fatty acids, literature has shown that they elicit an anti-inflammatory effect. They lower these inflammatory markers in the blood. They regulate our cholesterol levels. They decrease the bad cholesterol, which is also called low density lipoprotein. They protect against inflammation and free radicals. There are supplements which are available over the counter, or they could be prescribed as well, which contain the therapeutic dose of these omega-3 fatty acids, the EPA and DHA, and the dosing is 2000 milligram per day. Plus, as Dr. Khandelwal was mentioning, it's always good to take all of these good things, these good fatty acids or calcium and minerals from diet. So I would say, going forward, if I had to advise something to my family member or to my patients, I would say look at the natural sources of these fatty acids, which are good for your body and for your lupus. So these are all the natural sources, all the fish oil, olive oil, salmon, tuna, and other kinds of oils too. So incorporate that in your dietary habits. And again, as I said, one thing at a time. All of these changes cannot be made all together. Calcium and vitamin D. So we talked about vitamin D a lot, and it's vitamin D deficiency is very common. It's especially common in people who are living in Chicago, and also very common in patients who have lupus. And as Dr. Jolly was mentioning, patients who have, or lupus patients who have low levels of vitamin D are seen to have higher scores of inflammation in their body. Up to 2/3 of patients with lupus actually have low vitamin D. It has been shown extensively that vitamin D supplementation helps the bone health. So this is something which you should discuss with your provider. At some point in your lupus care, you should have your vitamin D levels checked, and based on your levels, you should get the recommended dosing for vitamin D. And once your levels are good, you should keep taking these vitamin D supplements to make sure your bone health is good. for the important reasons we've been discussing for last 2 hours. When it comes to if taking vitamin D would improve your other symptoms, like does it help joint pains, muscle pains, and fatigue, or if it controls the inflammation from lupus, at least the data or the literature is not that strong. And we'll look at some studies in a minute, but it's an undeniable fact that vitamin D supplementation is definitely good for your bones. So it's a good idea. Let's talk about other vitamins. There's vitamin E, there's vitamin C. These are known to decrease inflammation in the body, vitamin E and both vitamin C. And here I've listed just the natural sources. Looking at these, I don't want my patients to be forced to take vitamin E supplement, vitamin C supplement, and adding tablets and tablets to their pill box. We know our patients are on so many medications all the time. So I would encourage you and to look at the natural sources. Look what all fruit items, what are oils, these nuts, green leafy vegetables. These are all healthy food items which contain these vitamins naturally. Same for vitamin C, orange juices, papaya, your broccoli. Let's talk about other vitamins. Vitamin A, it also inhibits inflammation. It's seen in carrots, pumpkins, spinach, sweet potato. Vitamin B complex, it is good for your lipid profile. It is seen in, again, fruits, chicken, fortified cereals, nuts, eggs, avocados. Minerals, there's several minerals which are good for you, and again, these good food items which we have been talking about since the beginning of this presentation, the healthy eating pattern, the nuts, the cereals, the eggs, they have these minerals. So it's a good idea to eat a healthy eating pattern, not just for reducing your risk factors for heart diseases and vascular diseases, but also because they are antioxidant and they have anti-inflammatory properties, which is good for your lupus. We have talked about calcium at great length in the osteoporosis lecture. We know that the recommended dosing is 800 to 1200 milligram daily, and it is recommended, as Dr. Khandelwal said, to take half of that at least in your diet, and then the other half could be taken in supplements along with vitamin D. Iron supplements may be essential for those patients who have anemia. Okay, let's come to this next mineral, and that's salt or sodium. Sodium intake not only has benefit in controlling your blood pressure, but it also helps to lower the risk of kidney damage in patients with lupus patients. So it is recommended, especially for lupus patients, to adhere to a low salt diet. The salt content should be less than 2-3 grams per day for our lupus patients. Then I put down some questions about some supplements, which I thought I have at least heard questions about or are talked more about in the scientific literature. At least some patients have asked me about turmeric. So turmeric has been known about from ancient times. It has antioxidant and anti-inflammatory actions. There have been some studies on it in osteoarthritis and in other kinds of arthritis, which have shown that it has a role in controlling pain, and it may have some role in controlling inflammation in lupus as well. The problem with these studies and the problem with suggestion or the recommendation of turmeric is the compound itself is unstable, and the amount contained in these supplements, how much of that is absorbed, is not stable, is not something which is standard and or one could predict. So although it may have beneficial actions, but those cannot be relied on definitely. So turmeric or supplements like that should not be an alternative to your medication. This is the recommended safe therapeutic dosing for the turmeric supplements available, 400 to 600 milligram 3 times a day. I am not endorsing them. I'm just putting out some safe stuff out there just so that in case you are considering that for your lupus, you should know that they do not take place of your medications. There is a safety limit to these supplements. There are lots of other supplements, and they can have side effects. They should not be combined with some of your medications. So whenever you decide to start a supplement for yourself, you should let your doctor know what you're taking, just so that they can put it down in the system, and then they can also look up and see if you have any interaction with the medications you take, and if they need to caution you about any extra side effects or safety precautions. This is one product which has been talked about, at least in the lupus world, that it's specially recommended for lupus patients to avoid alfalfa. This is a supplement which some people might have heard about. Alfalfa tablets actually can induce a lupus-like syndrome and cause lupus flares. They can cause muscle pain, fatigue, and abnormal blood tests, including kidney problems. So if you've not heard about it, it's good. But if you've heard about it, this is one product to stay away from, especially. The other one, which there is some talk about and some data behind, is to stay away from garlic in patients with lupus, again, because it can cause flare of your lupus. This is some data or some scientific slides on what is the evidence of behind using these supplements. I'm not going to spend a lot of time in this, and I'm not sure if I'm running out of time. But so just to give a broader picture to my patients, we need a large sample patients data to say one thing is working or not working, and that should be compared against a dummy drug, because a lot of the times the disease can undergo flares and go into remission without medications and because of other things. So if you have given one medication and it worked, but you did not compare it against a dummy drug, or did not see how the disease was naturally progressing, it's hard to conclude whether the medication worked or not. There have been some studies looking at these supplements, but they have been tested only in small number of patients. For example, in front of you are two studies looking at the omega-3 fatty acids. They were studied in, as you can see, small number of patients, 66 women, again in 50 patients. One of the study looked at inflammatory markers in the blood. The other one looked at how their quality of life and activity of the disease was. One of them showed that it helped. It controlled disease activity. It lowered the amount of these inflammatory markers. This one also showed that the disease activity was better. These are two other studies, again looking at omega-3 fatty acids, and these did not show that the omega-3 fatty acids made any difference to the inflammatory markers. This is the one from the United States, and this one on the other hand did. So the conclusion is that we don't have strong data to say that the omega-3 fatty acid is absolutely necessary to be supplemented and would definitely improve your lupus. There is some suggestion that it might. We know that it is good for your body for sure. We know it is antioxidant. Definitely supplement that in your diet. And if you choose to take a supplement for it, that is also okay. It should not replace your medication, and you should follow the precaution that you take it just at the safety level and not more than that. This is these are some studies on vitamin D, and there was a lot of interest in vitamin D in lupus, and there is still, to see if supplementing vitamin D in higher doses, such as 2,000 to 4,000 units or higher than 4,000 units, affects the inflammation. Now, nobody is contesting the fact that vitamin D is essential for your bone health. You definitely should be taking vitamin D if you have low vitamin D, and then keep taking those supplements to ensure you have strong bones. These are studies looking at whether or not vitamin D made a difference to inflammation from the lupus per se. And the data is mixed. There were some studies which showed that vitamin D improved some inflammation. These two studies were negative. They did not show improvement in the inflammatory markers. It failed to diminish. This other study said the regimen was safe and effective, but it did not affect the disease activity. this one study showed that there was maybe some role. Again, these are small numbers, only tested on 9 women. This one study showed that maybe there is some role. This other study, which was a relatively large study actually, looking at vitamin D supplementation in over 250 patients, did seem to show that the inflammation markers got better and the disease activity got better. But this study actually was retracted from the journal in which it was published. They do not provide a reason for retraction, but my understanding is whenever the reviewers of these big journals have questions on the authenticity of the study, that's when they retract the study or when they have a question on the results. So again, for vitamin D, we don't have enough data to say it controls disease activity. And then this was a very small study for turmeric, maybe showing some benefit, I guess. That's why our patients hear about it and they ask us. Okay, and then I put down some random questions such as things which I have heard about or my patients have asked me about. What about coffee? You can drink coffee. Moderate coffee consumption, up to 3 to 5 8 ounces cups, is okay, and that can be incorporated into your healthy eating pattern. And in general, if I were to be asked about any food item in particular, whether coffee or chocolate or anything else, I would say anything in moderation is fine, as long as you're not exceeding, and then you're focusing on the healthy eating patterns. That's good for you. Lastly, I'm going to address this question which I got before the event. How can we use healthy eating to help lower blood pressure? And I hope I have been educating all of you in these healthy eating patterns, and all of those things help lower blood pressure. So there is strong evidence that indicates that reductions in salt intake and sodium intake will lower your blood pressure. And this is in patients who have high blood pressure and in those patients whose blood pressure is rather borderline. That gives me the opportunity to talk about this DASH diet, which again, as you read the description of it, is something very similar to the healthy eating pattern we've been talking about. This DASH diet stands for Dietary Approaches to Stop Hypertension. This is a special diet which is recommended to patients who have high blood pressure. The eating plan is high in vegetables, fruits, low-fat dairy, whole grains, poultry, fish, beans and nuts, and is low in sweets and sugar sweetened beverages and red meat. So if you read the description, we are basically talking about the healthy eating pattern. We are saying one thing which is important in this one is that the sodium intake is even lower. In general, for our general population, for lupus patients, we suggest them to take sodium or salt intake less than 2,300 milligram. But in the DASH diet, they lower that bar and say up to 1,500 milligram, and then maximum could be 2,300. And then just the same things as in healthy eating pattern, take less of saturated fats and less of extra magnesium, potassium, and calcium, because these minerals in excess have been shown to affect high blood pressure. So my take home and summary for all of you is lupus patients especially are at higher risk of cardiovascular diseases. They have comorbidities from high blood pressure, from cholesterol problems, diabetes, anemia, and osteoporosis to obesity. So they especially need to work on healthy eating pattern. These healthy eating dietary habits, they help in controlling these risk factors. And when you are focusing on these healthy eating patterns, maybe in your mind or just to get them into your routine, you could categorize them into these 6 categories or variety of foods and include these vegetables, fruits, grains, dairy, protein and oils, and then limit the bad things, limit the sodium, limit the solid fats, butter and processed meats and the added sugars. There is some evidence that these help in controlling inflammation nasally, and that's good for us. That's good for us to know, that good for my patients to know. And then when it comes to supplements such as the fatty acids or multivitamins and all that, there's no definite evidence that they would definitely lower your inflammation from lupus, but in general, there is no harm from them as long as you're taking them in safe doses. And this I'm talking about the fatty acids and vitamins and minerals in general. Talking about other supplements or herbs, as I said, definitely let your doctors know. There are some supplements which can interact with your medications, and there are some supplements which are contraindicated in lupus, like alfalfa or garlic, and those should not be taken for sure. And these are some resources. This first one is the dietary guideline, which I base my healthy eating pattern on. It's a very good resource. It gives lots of other options of how you could make that one change a time and incorporate these changes into your diet. So I would highly encourage you to look at it if you're looking at making changes or positive changes in your diet. And then there are some other sources for healthy eating lupus. And that's it from my end, LP. Thank you so
Wonderful.
much for listening.
Thank you so much. We do actually have a couple questions. We only have a couple minutes left, but hopefully we'll be able to squeeze some of these in. One is whole milk not as good for you as 1%?
Is whole milk not as good to you as 1%? Oh, whole milk. Yeah, so at least in the healthy eating pattern, because whole milk has higher fat content, they advise low fat or 1% milk over the whole milk. I would say if someone if someone is obese or they're trying to lose weight, then definitely go with low fat or 1%. If your weight is okay and your BMI, the body mass index, is less than 25, then you could choose to do the whole milk too. Especially if you're not eating lots of butter and lots of processed meat, and then it is not essential to replace your whole milk with 1%. It's not the biggest thing to do in your diet. If you're making other changes, if you're making sure you're not eating the processed meats and other fats, then you could stick with whole milk.
Okay. And then we did get another one. Should we avoid alfalfa sprouts and garlic used as food seasoning in usual amounts?
For the alfalfa sprouts, I would say yes, just because there's been at least enough studies to tell us that these can cause flares in lupus patients, and they can cause muscle pain and fatigue in my patients. So I would say yes, avoid them if possible. Garlic in usual amounts, in the it should not be a problem. I think when they make recommendations and they tell lupus patients to avoid garlic, is when they're using it as a supplement. So no extra herbal supplements for garlic, and definitely no extra herbal supplements for alfalfa.
Okay, so the garlic was a little confusing to me. I hadn't heard that before, but it makes sense. Like, so in normal, like, you can eat Italian food, you just don't go and take a bunch of garlic pills, which I know people do take for the healthy, but you're just saying eat garlic in normal amounts. Don't add. Okay, that makes a lot more sense. All right, wonderful. I don't see any other questions. I don't know if you have any other thoughts. Dr. Jolly did send out a message to everybody saying what did she say exactly? Something about for growing children, don't do fat-free milk. So I don't know if that means for the mom not to do that or not to feed the children, but either way, probably for, growing children, whole milk.
Yeah,
I would second that too. For growing children and even for pregnant women, I would not recommend or suggest fat-free or low fat. I would say whole milk for them for sure.
Okay. All right. Wonderful. Thank you so much, Dr. Arora,